Mr. Bear. My name is Kendall. I'm going to be your nurse today. I'm going to go ahead and provide privacy. Can you tell me your name and birthday? I'm going to look at the wristband. I'm going to verify the doctor's order. I'm going to be giving you an IV today. Do you have any questions about that? All right. So I'm going to perform hand hygiene. Have you ever had IV therapy before? No. All right. Do you have any allergies to medicine? Okay. So now that I have that, I'm going to go ahead and inspect the arms to look for which one would be better. All right. We're going to use this arm today. I'm going to go ahead and don gloves. Sorry for how bright they are. Okay. So now that I've donned gloves, I'm going to go ahead and open up my IV Strat kit. I'm going to move these gloves aside, and I'm going to remove my tourniquet. Alright. So with my tourniquet unrolled, I'm just going to apply a tourniquet to the client's arm. And just loop it underneath. And I'm going to palpate the arm, looking for a good vein. Once I find that vein, I'm going to release my tourniquet. And I'm going to go ahead and set up my primary infusion. I'm going to open up my primary tubing. And I have my solution. I'm checking the solution. It is not expired. There is no discoloration or cloudiness. It is clear. So without contaminating, I'm going to spike my bag. I'm just going to twist until they are flush with one another. And I'm going to hang my solution. I'm going to make sure that I have some in my drip chamber. All right, and now I'm going to open my clamps and let it run through. All right, so I'm getting out the air bubbles. All right, so I'm going to place this, I'm going to close my clamps and place this within reach without contaminating it. All right, so I'm going to now clean the IV site with some solution. Okay, I'm going to pop it, and I'm going to clean the site that we selected back and forth for 20 seconds. All right, I'm gonna allow that to dry. And while that dries, I'm gonna go ahead and set up my pigtail. So I'm going to open this. I'm going to go ahead and open up this. Okay. And dispose of that. And I'm going to get my blunt tip. I'm going to have that. And I'm just going to insert this into my pigtail. And I'm actually going to go ahead and prime it. Okay, so it is full. And I'm going to place this within reach as well. And now I have my IV needle. The site is clean and I have my dressings and everything. So I'm gonna go ahead and place my tourniquet back on without touching the site. Okay. So from the site that we selected, I'm going to secure the vein by holding it down. So I have opened up my catheter. I'm inspecting the tip for any burrs. I don't see any. The safety mechanism works. So I'm going to secure the vein about 2 inches below, and I'm going to go in at a 15-degree angle. Once I see flashback of blood, I'm going to lay it flush and go in about 1/4 of an inch more, and then push the catheter past the needle and insert to the hub. Then I'm going to lock the mechanism. Now I'm going to go ahead and place a gauze underneath this. Okay. So I have my pigtail within reach and my gauze in place. I'm going to remove this quickly. I'm going to go ahead and remove this cap. And I'm going to pull out and secure the pigtail. I'm going to go ahead and flush it with 5 milliliters. But a pool needle doesn't take it that well. Okay. So now that I know that my IV is patent, I'm going to go ahead and remove my gauze, and I'm going to secure it with a let go of my tourniquet and secure the IV with a transparent dressing. So I'm just gonna cover the hub with the transparent dressing and remove the cover. I can grab a hold of it. There we go. Okay. So now that the IV is secured, I'm going to disconnect it from the ceiling and wrap it around. And I'm going to get some tape. To secure the pigtail in place. So I'm going to place the pigtail up above the IV site. Okay, so that tape is not working, so let me get another piece of tape. Okay, so I'm going to place this up above the site. And now I'm going to get a alcohol swab. And I have my IV line ready. I'm going to open the cap a little. All of my clamps are secure. So I'm going to clean this I'm gonna go ahead and get my alligator clamp. And connect these two. And I'm going to connect this to that. And now that that is connected, I'm going to go ahead and begin my infusion. I'm going to open the clamps, and I'm going to make sure that the one at the side is open. And I'm going to open my roller clamp while adjusting the drip rate.